last 24 hours. So that is truly incredible. Great testing results. And once again, if you are sick, stay at home, get a test. Absolutely crucial over these next 14 days that anyone who has any symptoms whatsoever goes and gets tested. And just remember, for you going and getting a test, you are keeping all of Queensland safe. So thank you very much. And I know even members of my own family who have felt sick, who live in separate households to me, of course, they've gone and got tested as well. So everyone's hearing that message and everyone's doing the right thing. In terms of our vaccinations, we're up to 7,686 and we're now up to 87,220. So I'll hand over to Dr. Young to talk a little bit more about that historical case, which is absolutely excellent news that we found that she believes that missing link in that first original cluster. And Queenslanders, be safe over these Easter holidays. If you're out on the roads, take care, especially with that wet weather that's really due to come in Sunday, Monday. We're expecting a lot of rain. The Bureau will be keeping everyone updated. But once again, if you're out on the roads, it's going to be busy. Take care and look after one another. I'll hand over to Dr. Young.
Thank you, Premier. So excellent news, no community acquired cases in Queensland in the last 24 hours. So we still have those 2 clusters and we've still got to be careful for the next 14 days. So thank you for everyone for coping with these masks. They're very uncomfortable and hopefully we'll be able to get rid of them soon. But thank you, it makes an enormous difference. And before I go into the details of this most recent case, I just want to say to people who've been involved in these 2 clusters, they've done everything absolutely wonderfully. So I always say, let's find the first case in a cluster, not the 40th. And that will stop us then having hundreds of cases. So it's been an enormously successful process in terms of people coming forward and sharing information with us. People are so prepared to share their very close contact details with us and where they've been, and that must be so hard for individuals. So our new case is another nurse, and can I say we are so lucky that we have nurses and doctors and healthcare workers who are prepared to look after people with COVID. Today, across the world, more than 17,000 healthcare workers have died from COVID. So I thank every single one of our healthcare workers in Queensland who have been out there on the front line looking after positive COVID cases. So this is yet another nurse who has unfortunately, through doing nothing wrong, has contracted the infection from a gentleman who's clearly a super spreader. It's not his fault either. He was the gentleman that came from Europe and was admitted and transmitted the infection to a doctor. Now he has also transmitted it to a nurse. So that's the process that's happened. And then the nurse, again through absolutely no fault of her own, has then gone home and transmitted it to her partner, who is one of that group that we know who live in that North Brisbane area and are a close social network. So then it's spread within that network. And then we had the gentleman come forward just out of the blue and get tested. So due to all of those people doing what they did so effectively, we found that cluster and we've got it under control. So the nurse didn't develop any symptoms at all, and we managed to pick her up through being a contact, of course, and we've done serology, and it's the serology that's come back positive, not a PCR test. So we will never get virus that we can do a genome sequence on, but she's treated the same patient that the doctor who got infected treated. So it's clear that that's how she's got it, and then she's transmitted it to her partner, and it's then moved in that circle of friends and colleagues, which is what we know COVID does, which is why I really do want to continue that limitation on household gatherings to 30 people, because we know that's where COVID spreads. It's in those close areas. The other place, of course, is in hospitality, because people spend a lot of time there. They sit at tables and they're close together. So that's why we need to keep those arrangements in place for another 14 days. And again, thank you for that record testing. That is what will help us all, because we will find the next case and then we can get on to it quickly. I mean, you just think how few people we've had in these two clusters. We, Queensland Health, myself, everyone and the whole community has learnt what to do. Think back to the Brisbane Youth Detention Cluster. In the end, we got 50 out of that. So think how much quicker we are at reacting now. And that's thank you to all people across Queensland being cautious, being alert and coming forward and getting tested. Thank you.
Is the nurse's partner the tradie's brother, or?
It's too complicated. It's far too complicated. Yeah, she is definitely the missing link, and that's a friendship group. We all know our friendship groups, and they have been so good at coming forward and sharing that information. And it's private information that has been so good of them to share. It really has. So they're all part of a group, and they've spread one to another within that group.
Do you feel a bit more relieved now that
Yes.
we've got that? Can you just talk us through the relief of that missing case?
It's an enormous relief, because when you don't know the links, when you know that there's still something out there, I'm just never sure what else could be going on, what other chains of transmission, what other friendship groups could there be, what other venues. So you will see this morning a whole range of other venues that the nurse has been at while she was infectious. So she's never been sick. And I'm deeming her infectious period from the 10th, which was the day after she treated the patient, from the 10th through to the 23rd. So all of those venues she's been at, and she's shared them all with us, and she's got a fantastic memory. She shared them, we've got them out there. So if anyone's been to any of those venues that we're listing, they mightn't be sick anymore, because they might have had an illness and recovered, because this is so long ago. But if there's anyone in their house that's sick, or in their friendship group, then if they could say to them, it might be a good idea if you go and get tested, because we might then have some cases there. But I think given the amount of testing that's been done, we've probably picked up the cases, because there's just been an astronomical amount of testing. But it's important, if you've been to any of those venues and you're unwell, or anyone you know is unwell, just get them to come forward and get tested.
Has this nurse been vaccinated? You said that was through.
No, she hadn't been. It was still too early. So that's going back to the 9th of March, and we hadn't rolled out the program enough at that stage for everyone to be vaccinated. I can confirm this morning that we have put in that new policy, and only healthcare workers who've been vaccinated and had at least one dose of the vaccine can now manage cases. And that's, of course, for their safety. And I'm also going to be encouraging anyone who lives in the household of a healthcare worker that is now dealing with COVID cases. We've included you in 1B, so you can come forward and get vaccinated to try and protect the other members in the household. Because we know even if you have been vaccinated, you still can get the infection and pass it on. We've seen that, so it's important. We want to also protect the people who live in the same household.
Dr. Young, we're hearing that there could be some elective surgeries being cancelled because load stocks at Kinguard. Can you give us an update on that?
By who, sorry? I know elective surgery hasn't been cancelled. We'd never cancel elective surgery, we postpone it. So we have postponed elective surgery because we've had to decrease the number of patients at PA and manage that, and not put new patients in while we work all this through. So there've had to be some elective surgery cases postponed.
But is there a shortage of Kinguard?
Oh, that's the wrapping. Yes, there is an issue going on, but we're managing that. We manage those sorts of issues all the time. That's not a cause for decreasing elective surgery. It's because we've had to manage the outbreak at PA Hospital.
The supply of PPE isn't affecting those stocks at Kinguard.
I've heard that, but it's not. I mean, we've got lots and lots of PPE, and of course the world is using some of the material they use to go into PPE rather than going into other products. But just remember, we've only been sorry, you wouldn't be aware of this. That product is a paper-based type product that we use to wrap equipment in and sterilise. It's not that long ago we were using sheets to do that, green sheets. So we never had that product when I was a junior doctor. So there's plenty of other alternatives. It's not an issue.
With this outbreak sort of seemingly contained for the moment, how much of it do you put down to good contact tracing versus the actual lockdown? And I suppose what I'm getting at, is that lockdown element actually necessary if you have strong contact tracing?
We've got fantastic contact tracing, but there are a few things. There's never one thing that leads to a great outcome. If you rely on one thing for anything in health, you'll fail. You've got to have a whole lot of things, and it's all of those things together. So it's the fantastic contact tracing, it's the healthcare we're providing in the hospitals, it's the quarantine system. It's the fact that must be over 100,000 people now have come out and got tested and done all of that. It's the social distancing. It's the fact that we're all putting masks on again. It's so many things that all combine. The reason we needed that lockdown is we had 2 clusters. So the first cluster, I didn't recommend to the Premier that we needed to lock down. I felt that we could just work through it. But then to get a second cluster, that's an enormous amount of risk. So one, I sort of was a bit okay to take the risk and work it through and see how we went. But to get a second, that's too risky. And Queenslanders have done so well to go and then end up with an outbreak that might lead to a much longer lockdown just wasn't tenable.
So is that the new threshold now, do you think? If there's 2 clusters, that's when, yes, we'll see future lockdowns?
It's really hard to say. Thank goodness, we're not seeing enough things like this to then make determinations how we'll go in the future. We have had so few clusters in Queensland, so each cluster is an individual cluster. And it's a matter of looking at what's going on out in the community, what's happening in testing, etc., where we're up to with the vaccination, and making a decision then about how to deal with it. So each cluster looks at what is the best thing to do.
How much of the Pfizer vaccine do we have left?
We've got, I was told yesterday, I haven't had an update from there, 3 days supply.
Are you expecting more?
Yes, I'm expecting, yes, more deliveries, yes.
This weekend?
I don't know.
Okay.
No.
Given that we've now had that missing link found, are you confident this cluster is contained at the PO?
Not totally confident. I'm never going to be totally confident till everyone's vaccinated. You just don't know. You really and truly don't know that there isn't another case, that there hasn't been another transmission. That's why we have to maintain our restrictions and our mask wearing for another 14 days. I declare a cluster over, 2 incubation periods after the last case.
We might just go on to the Deputy Commissioner first, if that's all right?
Sure.
Yeah.
Thank you, Premier. Good morning. Just a really quick update in relation to our operation. So we've seen no enforcement action taken in the last 24 hours, which is very pleasing. So thank you to Queensland for being so committed to working with us, and in particular in the mask space. Whilst we've handed out 1,349 masks, we've only had to take enforcement action on 2 occasions, which is very, very pleasing across the state. Just a reminder, as you are aware, there are still restrictions in place, and people will need to be aware of them. That includes mask wearing, and there is a $200 fine for those people that don't comply with that direction. Could I just say really quickly to the community, can you apply the same sort of commitment on our roads? It is really concerning, really concerning, despite all the messaging, that in the 24 hours till midnight last night, we'd had to issue over 1,000 traffic infringement notices across the state, so 1,076 to be precise. And we've seen 22 injury crashes already and 28 people injured, and I understand earlier this morning there's been a fatality in the north. So look, we really wanted to get through Easter without losing anyone. We haven't even achieved that already. So please, the message is out there. As the Premier said, we're expecting some pretty wet weather. Please drive to the conditions and take care. Thank you.
We just heard about a identified as a close contact of the case and then left the hospital and police helped track her down.
Yes, we were engaged yesterday morning. Health had identified that a person had left the Princess Alexandra Hospital. We tracked that person down yesterday at New Farm, and she's been returned under quarantine direction to the PA hospital. I'll leave it to Dr. Young if you want to talk about any of the medical side of it, but everything's been done that needed to be done, and she's been returned. Thank you. So it was from, I don't know the precise time, but it was early hours of the morning, something like 3 a.m. or something of that ilk, and she was located yesterday afternoon.
Do you know whether she visited any venues in that time?
That will be all covered in contact tracing, so I don't have the precise details, sorry. Thank you.
The Victorian Health Minister's called to stop cheap politics over jab delays and to put down swords. Your deputy seems to like to swing the sword. Are you...
Well, no. I think the Deputy Premier clearly responded to comments that were made by Mr Littleproud. So that was clearly the case. And no, we're not going to stand there and cop people not telling the facts. So if we will call out if the facts are in dispute. We will call that out, and you saw New South Wales and Queensland call that out.
But does it have to turn into name calling and this sort of type of politics?
Well, look, I'm not going to get into that now because it's in the best interests of all of Australia that the governments work together. And we've got a National Cabinet meeting happening next week. I am going to raise the high number of positive cases that are coming in from overseas and the sorts of demands that is putting on our hospitals and in other states on their hotel quarantine. What we are seeing is these infectious strains now coming into Australia, and that puts the whole public at risk. So maybe until the vaccination program is ramped up by the federal government, the number of return travellers needs to decrease Australia-wide. So these are some of the issues, and these are legitimate issues that I think Queenslanders would want me to raise at the National Cabinet level.
How concerned are you that there's only 3 days left of the Pfizer vaccine supply?
Well, as Dr. Young said, we're hoping to get more, but as I said again, transparency I think is the key here in terms of we give out our figures every day. I think the federal government should give out their figures every day, and we should have a rolling list of weekly when the deliveries are coming and how much. That would just help everyone. Last couple.
Today,
sorry?
Businesses are obviously
celebrating
Good Friday. They've raised concerns that the request for concessions today have been ignored. What's your message?
No, well, as I said yesterday, the Treasurer and the Small Business Minister were going to have some discussions. We're going to wait to see what happens over the Easter and school holiday period, because I think what you'll see is a lot of Queenslanders want to go out and support businesses. I mean, even on your programs last night, you were showing people wanting to go out straight away as soon as the lockdown was lifted to support those businesses. So look, it is tough, and like I said yesterday, these decisions are not easy decisions, but we've got to take the health advice. If we don't listen to the health advice, the consequences are going to be far worse long term for businesses and the tourism industry.
Last one. To halve the international travellers until the end of April yet?
I haven't received anything back yet. I'll chase that up, but he has agreed to the first 2 weeks, and my request was to ask very clearly if we can have that second 2 weeks till the end of April. But as you saw today, we've got another 7 cases coming in from overseas. We're seeing around this 5 to 9 cases daily coming in. So that's putting a strain and puts everyone at risk. It puts everyone at risk.
On that, are you taking to National Cabinet a proposal that all states would reduce their, are you...
Well, we're the ones that are seeing the most. I think out of all the states and territories, my understanding would be that we are the highest at the moment. Queensland is the highest because of the number of people returning with the infection coming into Queensland. So the halving is a good first measure, but maybe we need to have a look at the vaccinations, and that you would actually ramp up that returning travellers as the vaccination ramps up. So these are just logical questions. Last question for Dr. Young, and then we'll let everyone go. Thanks.
Thank you. Dr. Young, can I ask you about this woman who's breached her quarantine by leaving the hospital? Does that pose any risk to the community?
I don't believe so. Remember, she's not a case. She's a contact of a case, and she was tested on the 30th of March and she was negative. then, and I've asked them to urgently do another test on her, so I'm expecting that result soon. So if she's negative again, and then we'll test her again 3 days after that, then there's absolutely no risk. But I really think it's very low risk. She is a contact of a case.
Thank you, everyone.
Thank you. Thanks, everyone.